what are hormones? So hormones there are a range of hormones. There are sex hormones for both genders, men and women. So male sex hormones, the key one is testosterone. And if we think about it, sex hormones are largely influencing development over puberty. Okay, so that is when, in the case of boys, transitioning into manhood, and in females, girls to women. The female sex hormones, again, there are a few, but we'll talk about also how men do still have estradiol, for example, and it is important to have healthy levels of that. And again, abnormalities there can also signal other issues as well. And so it's all about balance. But women do also have testosterone as well. It's very popular. I'm sure online people have been reading about women being prescribed testosterone as part of their HRT treatment, hormone replacement treatment, typically during the time of menopause or perimenopause. Now, testosterone quantities differ massively between women and men. Obviously, women have much lower quantities of testosterone, and men obviously have a lot more testosterone. They produce a lot more testosterone. And testosterone in men is typically produced in the testicles, and it is driven or under the influence of other hormones. Okay, so hormones do work in axes, and that is typically coordinated up at the level of the brain with the hypothalamus and the pituitary. And these are glands that release other hormones. So now we get down to follicle stimulating hormone. We shorten this to FSH. Okay. Now, FSH is essentially a signal from the brain down to the testicles. So it's on the hypogonadal pituitary axis, or the HPA axis is the scientific kind of description we say. And if the FSH is high, it will potentially signal problems with low testosterone. Okay, the signal to the testicles is to make testosterone, and sometimes if there is difficulty, it works with feedback. So if the testosterone levels are detected to be normal, feedback goes back to the level of the brain, and actually that tells us that we don't need more. If the level is low, so it detects there's low testosterone in the bloodstream, well, actually, first thing that happens is the brain tries to send a signal to make the production of testosterone increase from the testicles. Okay, so boost things up. So you see a rise in your FSH. Okay, and that can sometimes be an early sign that testosterone levels are sort of really struggling, and actually someone may need some support there. Now, in your case, your FSH is slightly on the lower side, but again, well within the normal range, which is quite positive. What we do also find is people who are on TRT, whether that is prescribed or people who may be taking anabolic steroids, so artificially boosting their levels to what we term supra physiological, so supra being high, overly high, higher than what is physiologically normal. This is detected in the bloodstream, and so it shuts down the production of FSH and another marker called LH, luteinizing hormone, which in this screen is further down. Because obviously it's saying we don't need more testosterone, so let's damp things down. So those levels do drop down. With your level, though, somewhere in the normal range, I think that's a sign of things being healthy. There aren't any concerns. Like I say, we know something is off if the levels are very, very low. So in the red here, or if it was on the higher side. Okay. Yeah. And the final thing on FSH is it also helps control sperm production. So if people are concerned about fertility, this is probably important to look at as well. Okay. So low levels of FSH, and if someone's definitely not on steroids or taking anabolic steroids or on TRT, then again, it would prompt us to look into what exactly might be happening. Okay. Now, free testosterone. So one of the key aspects that we do look at. So I should probably talk about total testosterone at the same time. That happens to be further down here. Sorry about the ordering on the system. Now, typically, total testosterone gives us the whole picture. In the NHS with a GP, this is typically the only marker that is tested on testosterone, the total testosterone. The cutoff in the NHS is 8.6 nanomoles per litre. So anything 0 to 8.6 nanomoles per litre or less, so less than 8.6 is considered to be low. Anything above 8.6, so 8.7, 8.8, 9, 10, 15, 20, 25, 30 is considered to be normal. Now, what do we know? So we know that total testosterone levels are going to be highest in puberty and in early manhood, and then they do tend to decline between 1 to 2% per year of life from your 30s onwards. So mid 30s, 40s. In your case, we'd expect that your testosterone level now is at least 10, 20% lower than what it might have been 5, 10, 15 years back. That is expected biology of aging. Now, what about free testosterone? So, like I say, the NHS only tests the one marker. And if you score 9 nanomoles per liter, you may still be symptomatic, quite symptomatic, actually. And yet that would be the end of the discussion. Now, if you are lower than that, you will be referred typically to an endocrinologist, but that does often take many, many months to get there. And that specialist would probably confirm the blood test, so doing a second blood test. If that is found to be repeated low testosterone, they also look at the free testosterone. Now, why is free testosterone important? Well, free testosterone is actually what is biologically bioavailable, what can actually bind to cells, can actually lead to some impact. Okay. Now, it's possible that the free testosterone is low because it is all mopped up. It is basically bound to other things such as SHBG, which we'll see further down on the screen, sex hormone binding globulin, binds it up, swallows it up, and therefore it's not available. And so it's possible that with a normal total testosterone, somebody could still be symptomatic of hypogonadism because their free testosterone is low. Okay. And that is, again, an indication where TRT may be available and appropriate. So where does TED's Health come into this? We follow the British Society of Sexual Medicine, which is a medical institution with lots of experts that have contributed, looked at the data and the research, which shows that actually levels between 8 and 12 nanomoles per liter of total testosterone are typically associated with some of the symptoms. And in some cases, for men who may also be pre-diabetic or diabetic, that could even extend between 12 to 14 nanomoles per liter. And there are some very good benefits where someone is pre-diabetic or diabetic, having a total testosterone of, say, 12, 13, or 14 nanomoles per liter and having symptoms that when brought on to TRT, they can actually see some improvements in their blood sugar control, their glycemic control. Okay. I have seen that with some patients. So it may be appropriate. And there is a very close interplay between your hormonal levels as well and your blood sugar control. Okay.
So in terms of that, Johnny, sorry.
Yep.
So there's a good chance that if someone's been to the NHS doctor, not about testosterone, it might be anything from low mood, being lethargic, the NHS would do a test and they could be in the NHS range, but that doesn't mean it's being optimized. So they could have a bit of a testosterone problem, but that just be completely ignored because it fits the bill. Whereas what you're doing is testing and saying this is more of an optimal range, and we want to, the benefits of being in that are being, definitely. That's really interesting to know because I expect most people, particularly people my age, will have been to the NHS, the doctor's hospital for blood tests a number of times by this age, and a lot of people will just think, well, that'll have been tests, so I'm right. I know I'm in they've never mentioned it, so why wouldn't? But there's a difference between ticking an outer box or being in a range that's a lot wider than saying, right, my testosterone or whatever is in that optimized range that's going to give me these benefits as a result of it.
Yeah. And I think you hit the nail on the head. Again, we're not here to, complain about the NHS. The reason that there's this discrepancy is probably multiple factors, but one, this is historic. There wasn't as much research and understanding, some decades gone past, and it stayed there, unfortunately. The second one is also the NHS, unfortunately, is designed around price. So, and commissioning and understanding about treatment. The third and probably the most important is we should not get hung up on numbers alone. It's actually down to the individual with symptoms. And why I say that is many people will see ads on the tube nowadays about low testosterone and say, oh, I've got that. I've got tiredness. I've got, lots of morning erections. I feel anxious. I've got brain fog. My muscle mass isn't as good as it was when I was 18. I've got increased fat. These are all things that I'm sure middle-aged men will relate to at some point in time.
Yeah.
And actually they may do a blood test and completely have normal total testosterone and free testosterone, and then they say, well, I don't believe that. And that goes to show that there could be other health problems that could be contributing, and we don't, this is somewhat beyond the remit here. And I would always be very open and transparent. And so if somebody does have symptoms but the bloods are normal, it's not always the case, that there is no problem full stop. There must be something else, but there might actually need further testing, maybe looking at other things like your thyroid level, and other things as well.
And I expect if someone has a test in a very stressful period, so that something's happening in their life, and obviously the stress hormones are at an elevated level, that's going to go against the testosterone. So I think,
absolutely. Okay, so with normal free testosterone here, again, that's very encouraging. So again, we do kind of follow loosely these reference ranges here. So if a level was kind of 0.05 or 0.0 or lower, then we would obviously worry that low free testosterone, irrespective of the total testosterone, is a problem. And if a man is also symptomatic, then we would look to obviously repeat it to confirm that it wasn't just a one-off reading, which again is massively influenced on things we've spoken about, like other hormones, like cortisol, like stress and lifestyle. But that may support a diagnosis of low testosterone, and maybe appropriate having a discussion around TRT, testosterone replacement therapy.
Yeah.
Now, estradiol is very interesting. So we spoke about sex hormones, so women's sex hormones, so estrogen or estradiol being one of those. Now, why are we interested in the context for a man? Well, it is still important. It does help build the foundations for healthy bones, amongst other things. So we do get worried if somebody has very low levels of estradiol. Okay. Similarly, with low testosterone, you could have very low levels of estradiol. For men who are on TRT, if they are having high levels of testosterone or having TRT too frequently, that can push the estradiol level too high. And that's also not a good thing, because that can cause feminizing changes to the body, commonly development of breast tissue, sometimes cruelly termed man boobs. Gynecomastia or gyno is the medical term, can be a symptom of high levels of estradiol, which is sometimes seen with people on TRT or taking optimizing their steroids through illicit means as well. So very important that this is kind of kept within what is considered a normal range. In your case here, again, this is something I'd consider to be okay, not an area of concern.
If someone was to have very high levels of that, what solutions would there be to bring that?
Yeah. So again, there could be a number of causes, and it's a conversation to be had. If we identify that somebody is taking TRT, for example, again, it does happen with some patients, we would look at how we can adjust the dose or the frequency. So let's say they're self-injecting with a short-acting testosterone like testosterone cypionate, a self-injection done typically every 2 days or so. If somebody is doing daily injections, or they're having too high a dose, that might be the answer there. And we have to look at kind of, or sometimes it's actually having a high dose, but only once a week, very high dose. That could be the cause. We look at see how we can break down the dosage, spread it across so that the levels don't go too high. So it could be a dose adjustment. It could also be a case of, again, screening for any other health conditions, which may be causing an excess of estradiol production.
Yeah. And I'm right in saying, though, there are a number of, I know of teenagers and young adults who have got that, in what we effectively call as man boobs, coming through from an early age, who obviously aren't on any TRT and that. And it can just be a natural levels that are high. So I take it there's ways that can be brought down, or
it could be natural. There could be genetic predisposition to it. And again, having that conversation, ask about family history. So again, it's building a picture, again, depending on where someone is, age-wise and how long it's been ongoing for. Potentially there are things that may be able to be advised on or optimized. Sometimes it's a little bit more complicated. And we do obviously know that in some cases, people do end up having surgery for that. So it's gotten to a point where it's irreversible. Obviously that's a little bit more of an unusual cause. It's not everybody's needing surgery in most cases. But yeah, definitely worth a kind of discussion again, if we're finding that. Again, we obviously not just take one reading in isolation. We ask about the symptoms that someone's having, and build that bigger picture up.
Yeah. Right.
Now, prolactin's a very important, interesting one as well. So prolactin levels, again, in your case, considered to be normal here. Now, we get a bit more worried when levels are high. When we say high, 500 plus, or double that, so double the upper limit, so 1,000 and beyond, can indicate in some cases a benign type of growth, so a tumor that's non-cancerous somewhere in the brain called a prolactinoma. I have seen a couple of cases of this, and this is typically someone who presents with symptoms of low testosterone. We find that there's low testosterone, but we check the prolactin, it's very, very high. And it is growth that someone may not even be aware of. This is not necessarily causing them to have other symptoms of like headaches and, and like I say, it's non-cancerous, but identified in an MRI, maybe something that somebody does go on to have surgery for. And it can be the cause of other hormonal imbalances, which once surgery's happened can actually correct the underlying cause and could lead to normal levels of testosterone afterwards. So in the context of testosterone deficiency, very important to look at. High levels of prolactin are also associated or impacting mental health and mood. So people might be found to have lower mood. Can also impact, again, in kind of sexual symptoms. Prolactin is associated with kind of libido, refractory period. So people might, or even difficulty kind of achieving an orgasm as well. So if people are having sort of sexual dysfunction, essentially, so feeling things are not right, low interest, not really in the mood, not really actually feeling their function normally, worth getting bloods and new prolactin looked at. Potentially, that's on the higher side, might be something to look more at. And these obviously, therefore, I mentioned about mood as well, can be massively influenced by certain types of antidepressants, so SSRI medications, citalopram, sertraline, these types of medications as well.
Yeah.
Okay. So moving on, PSA. It's not public service announcement. It is the prostate-specific antigen, PSA. Very, very topical in the media, in the news a lot, especially around prostate cancer. It is a screening marker for prostate cancer. It's also a monitoring marker if somebody does have prostate cancer. So also for people who are on treatment. It is important. It is, but it can be misleading. Unfortunately, there is a lot of false positives. So a high level of PSA, some people have levels of 5, 10, 15, 20, doesn't always mean it is cancer. Unfortunately, I have sadly seen a case where there was a high level of 30, which I believe was an erroneous sample. It was repeated multiple times. Also, the patient ended up having an appointment to have a physical prostate exam as well as having an MRI, all of which was very comfortably reassuring with no evidence of any growth. So no prostate cancer ruled out very comprehensively. But the PSA, why was it high in that one reading? There's a few causes, and we say this a lot. You'll see lots of people in the press, GPs, complaining about too many PSA tests being done. It can be increased in the short term by recent ejaculation. So somebody having sex, in the hours before blood test or the day before blood test, even up to 72 hours, could be one of the causes. It could be related to infections, especially infections around that area, or infection of the prostate, like prostatitis, or possibly urine infections. It can be associated with vigorous, intense exercise, specifically cycling, I guess, being on a bike, which is very close to prostate, prostate being kind of a walnut-shaped gland, which is situated between the bladder and the rectum, so kind of that lower end of the pelvis. Lots of intense cycling can be the cause. I have seen it also from other types of from sports players who've done very intense exercise or back injuries. And with how do we know it's that? It's because we process of elimination. We've then done repeat tests. We've gone and done maybe scans or examinations and other things, and this is resolved over time. So we don't. So as you can understand, a high level of PSA might be a warning sign, and needs obviously follow up, repeat, and further investigation to potentially look at prostate cancer. For all our men at Total Health who are on TRT, we check this every 3 months and we look at the trend. And if we see the trend is slightly fluctuating up or down, that's fine. But if we see sudden jumps, we call this the PSA velocity. If the jump is more than at least 1.4 micrograms per liter in a year, then we may consider pausing therapy and maybe looking at further investigations to screen for prostate cancer.
Yeah,
it's probably worth.
Sorry, that goes back to the self-diagnosis. Someone decides that they need to be on testosterone based on their own feeling, not results. The aftercare of it is they just keep taking it. They don't do any tests to monitor how things are going. They just think that's the solution, and I just keep doing it. Whereas you guys are not just prescribing the thing, you're actively monitoring as people go along the journey, and I think that is key.
So final, but probably very important point to say is there's lots of concern and stigma that TRT and testosterone is associated with prostate cancer. This has largely been dispelled by very large-scale studies, where actually there isn't an association with TRT causing prostate cancer. One has to be very careful for men who have had prostate cancer and use of TRT. Again, that's a very specialist area, but again, that there are times when that can be done appropriately and safely under specialist care. Yeah, it's very important to highlight that, because I think there is a bit of misconception, myth, and people get worried about getting prostate cancer simply by taking TRT. There is probably also, again, less people are aware that men can have breast cancer. Again, if somebody has a high genetic risk, so there is a type of genetic cancer that runs in the family of breast cancer,
yeah,
there is a small chance they may be more predisposed for the risk of breast cancer from taking TRT versus not taking TRT. Again, that's a discussion point that we have with all patients, and that's one of the reasons asking about family medical history and genetic conditions that run in a family.
Yeah, absolutely.
Okay, getting towards the end. So now SHBG is what I said earlier. That's the acronym, sex hormone binding globulin. Quite a mouthful. Now, we spoke about free testosterone, freely available, freely bioavailable, but it might not be so freely bioavailable if it's bound to certain types of proteins like this globulin. There's also globulin, there's also albumin as well. But these are essentially proteins that can bind to certain types of cells and hormones and testosterone as well. If you have a high SHBG, that could mean that it mops up the free testosterone, and therefore one could be symptomatic of low testosterone. So it is important to know the SHBG level. In your case, I mean, 38.4, it's kind of pretty much in the middle. So it's neither high, no low. So that's a very reassuring thing. But yeah. If SHBG is on the lower side, we could see the shift to actually having more free testosterone as well. So again, right. You've got kind of quite almost middle of the ground normal level there, which is quite reassuring and does fit with your results.
Yeah.
Now we've come to testosterone, and this is actually referring to total testosterone. And we almost started a bit back to front because we started with free testosterone, but I did hopefully cover this quite well. 8.6 nanomoles per litre is the cutoff, and anything above that is considered normal in the NHS, although we know that between 8 and 12 nanomoles per litre, men may have symptoms. In 13 to 14 nanomoles per litre, pre-diabetics and diabetics may benefit from TRT, and we know that levels from 14 nanomoles per litre and less typically are associated with symptoms. The number one symptom that a man may see if their levels are, less than 14 nanomoles per litre total testosterone is loss of morning erections. Now, many people will cast their mind back to puberty, teenagers, and early 20s, and everyone has morning wood, as we say, and then that probably does decrease as we age. And numerous factors, including psychological factors as well at play, and lifestyle factors. But it's probably it's important to say that actually, if someone does consistently notice that they are struggling or not having morning erections, that actually it's worth checking your testosterone levels, and it may be associated with a lower total testosterone plus minus free testosterone, and therefore it might be worth a consult and discussion about that. But yeah, levels of 17.1 nanomoles per litre, so in your case, Ian, that's obviously very reassuring. Now moving on to triglycerides. So again, part of that lipid panel, triglycerides typically associated with saturated fat. We are obviously slightly more concerned about higher levels of that, and obviously the negative impact that can have when it's consistently high on blood vessels, and then that leading to heart disease, strokes, etc. 0.93 millimoles per litre, so that's quite a reassuring level. So it's obviously, again, your diet is obviously, all things considered, I think very balanced, and that's the proof is in the pudding here.
Yeah.